Hello everyone, this is Dr. Matt Reedy with Trillium Creek Dermatology. We are here today with our patient Taylor and we will be doing some Botox on her. So Botox is an FDA-approved toxin that we use to relax muscles that create facial expressions, and we use them to reduce wrinkles. That's the main purpose of it. Today we'll be injecting her forehead lines, her scowl lines, and then her crow's feet, which are the wrinkles you get on the sides of the eyes from smiling. We do use Botox for various other things other than wrinkles. You can use it in the masseter muscles, which are these strong muscles that you use for chewing. Some people clench. So a lot of people who have TMJ can have very strong masseter muscles, so you can inject some Botox there to soften those muscles, prevent clenching, teeth grinding, things like that. You can also use it around the lips for something called a lip flip, which is where you inject a small amount of Botox along the border of the lip there. It everts the lip and gives you a slightly more volumized look to the lip. We also use it down on the neck. Some people get kind of vertical bands. They're called platysmal bands. And if you inject a little bit of toxin along platysmal bands, it can really soften that as well. So various things you can do with it. Sometimes we do put it in the chin as well right here if you have a dimpled looking chin, which she doesn't, but various things you can do with it. But today we'll be kind of focusing on the upper face. One thing to mention though, occasionally people who are prone to migraines, they do see improvement when we do cosmetic Botox as well. Neurologists use it frequently for migraines, and they'll use additional injection points in the scalp and on the neck. We typically just inject on the face, but I have had patients say that it improves their migraines as well. So we'll get started. Okay, go ahead and scowl for me. Good, relax. So those injection points right there are for the scowl movement, which gives you the 11 lines, we call them, these vertical lines that form there on some people. And you have two muscles that sit above the eyebrows here called the corrugator muscles, and they pull in. So to help with those vertical lines, you really have to hit those corrugator muscles to prevent that movement. And go ahead and raise your eyebrows up. So you have a big muscle that sits here that pulls the eyebrows up and can give you horizontal lines. That's called your frontalis muscle. So if you put some Botox along the frontalis muscle, that will relax that as well and smooth out any horizontal lines that you can get. We're going to do her crow's feet now, which are these muscles over here that creates those smile lines that occur on the sides of the eye. And what Taylor's feeling, small little pokes. It's not extremely painful, is it, Taylor?
No, it doesn't hurt at all.
No, very pain-free actually, minimal pain, but small little pokes. Risks of the procedure are pretty minimal. Sometimes you can get a little bruise here or there, but so far she's not having any significant bleeding or bruising. And Botox typically takes about 1 to 2 weeks to fully kick in. So the next morning you won't wake up and see any changes. You'll look exactly the same. However, in a week you'll start noticing improvement. In 2 weeks you'll see the full results. And the results typically last 3 to 4 months for most people. So turn that way, give me a big smile. Good, relax.